This is an African American health fact sheet that I pulled from the NAACP's website. You can actually Google this and get these same statistics. I'm not going to read all these statistics, but I just want to skim through it and give you just a little insight on why I am so diligent about what I do as a doctor of holistic nutrition. In 2003, the death rate for African Americans was higher than whites for heart disease, stroke, cancer, asthma, influenza, and pneumonia, diabetes, HIV, and homicide. Uh, the black infant mortality rate is more than twice as high for white infants. The following statistics give some illustration of other grave health concerns that disproportionately affect African Americans. And I'm going to skip through some of this, but the point that I want to make is that they quote that African Americans are 25% more likely to die of cancer than white Americans and more than twice as likely to die of diabetes. 7 in 10 African Americans suffer from obesity compared to 6 in 10 white Americans. African American children are also more likely to be obese than white children. You know, today obesity is an epidemic. I, Let me rephrase that. Childhood obesity is now an epidemic in this country. So that's just to give you a little insight as far as how those diseases are affecting African Americans. When it comes to obesity, being overweight or obese also comes along with the chances of, suffering from hypertension, high cholesterol or high triglyceride levels, type 2 diabetes, which is diabetes that actually happens later on in life as a result of a poor diet or, you know, pretty much the results of a poor diet, or once a person becomes overweight, then type 2 diabetes actually sets in. Also, being overweight puts you at risk for coronary heart disease, stroke, gallbladder disease, osteoarthritis, um, sleep apnea, and respiratory problems, some cancers such as endometrial, breast, and colon. Heart disease is the leading killer across most racial and ethnic minority communities in the United States, accounting for 27% of all deaths in 2004. African Americans are 1.5 times as likely as non Hispanic whites to have high blood pressure. 31.5% of African Americans have hypertension compared to 21.3% of whites. African American men are 30% more likely to die from heart disease than non Hispanic white males. This occurs despite the fact that 10.3% of African Americans have heart disease versus 12.6% of whites. And these sources actually come from the Office of Minority Health. As most of you know by now, I am Dr. April J. MacAlpine. I am a board certified holistic health practitioner, and I am also the founder of General Nutrition Education Services, or GNES, for minorities. Based on these statistics, my practice is definitely needed. Doctor for minorities. We need it. We need this attention. We think we know, but we don't know. The statistics are in. Things are only getting worse. We're not improving in our health. Health insurance are not going to be covering for diseases that are diet related. They're actually already kicking back coverage for diabetes medication, heart medication. I'm learning these things from teaching my program, and my students are actually confirming what I'm saying. So I always, like I tell people, is it going to be healthcare or self-care? We can't blame or no longer put the pressure on healthcare. We need to put the pressure on ourselves, because health begins with us. So you can actually give me a call to at 910-200-5464. I'll be glad to discuss. I do public speakings. I am now also the proud author of my published book, or my dissertation, my doctoral dissertation, entitled The Correlation of Anemia in Pregnancy and Mental Illness. I have 20 years of nutrition experience. 18 of those years are as a public health nutritionist. So I have the education, and I also have the personal experience, and I have the professional experience. So give me a chance. If you need a personal doctor to guide you back to health, I am she. Have a healthy day.